Hello, and welcome to this short educational video about sepsis. My name is Leah Meyer, and I'll be your host today. We are glad to have you with us as we take a closer look at what you can do to improve the quality and safety of patients diagnosed with this deadly disease. Now sit back, relax, and prepare to learn more about sepsis. Timing is everything when it comes to sepsis. In the United States, sepsis takes 270,000 lives each year. For every hour treatment is delayed, the risk of death increases by as much as 8%. Those are scary odds. As many as 80% of sepsis deaths could be prevented with rapid diagnosis and treatment. In today's session, we will track a real-life scenario of a patient who developed sepsis. We will follow him all the way from his physician office visit through his entire hospital stay. You will see how quick identification and treatment of severe sepsis and septic shock can result in a positive outcome for the patient. Our story begins once upon a time in a faraway land called Madison, Wisconsin. There was a gentleman named Melvin. He presented to his SSM primary care physician, Dr. Gill's office, feeling just plain lousy. Melvin had been complaining to his wife, Barb, that his cough was getting worse and he felt like he had a fever. Barb noticed that he was becoming sicker and sicker by the minute. Nurse Mary began assessing Melvin, checking his vital signs and listening to Barb's concerns as well. Nurse Mary was quick to notice that Melvin's vital signs were not normal and that she better notify the doctor fast. Dr. Gill began assessing Melvin and trying to figure out just what could be going on with his patient. Alas, could Melvin be battling SSM's evil nemesis, sepsis? 3 SIRS criteria, signs of infection, and organ dysfunction criteria have been met. Dr. Gill had remembered that these signs and symptoms were on the Sepsis Core Measure tip sheet that his Patient Safety and Quality Department had sent to him. This must be serious. He quickly rushed Melvin on his way to the St. Mary's Hospital emergency room. Dr. Gill called report to the emergency physician and shared his suspicion that Melvin may be developing sepsis. It's always important when a patient presents with signs and symptoms of an infection, at least 2 SIRS criteria, and 1 or more signs of organ dysfunction criteria to suspect sepsis. Quick identification and treatment can save lives. In the emergency room at St. Mary's, Nurse Deidre began assessing Melvin, and she also identified that he could possibly have sepsis. Dr. Barton assesses the patient and starts care using the sepsis order set. The Sepsis Bundle Core Measure guidelines were followed by the team. Every hour delay in antibiotics increases mortality by 8%. Therefore, caring for a patient who has sepsis is time critical. Multiple disciplines and departments are involved in providing timely care. Clear communication during the handoff process from the ED to the ICU is essential. Sepsis interventions are time limited. The receiving unit needs to know which interventions of the sepsis bundle still need to be completed. Melvin's systolic blood pressure is only 86. This meets the Sepsis Core Measure definition for hypotension. Melvin's mean arterial pressure is now 64. Because he has had 2 consecutively low blood pressures, Melvin meets the Sepsis Core Measure definition for persistent hypotension. Dr. Lacoste continues to follow the Sepsis Core Measure tip sheet guidelines and orders a vasopressor and second lactic acid to be drawn. The Sepsis Bundle Core Measure guidelines were followed by the team. Dr. Lacoste does a complete physical examination of Melvin and documents his volume and tissue perfusion assessment using the EPIC smart phrase .sepsis focused exam. SSM Health data shows that patients who have completed the SCP-1 Sepsis Core Measure Bundle have an almost 50% improved survival rate than those that do not. As you can see in Melvin's case, all of the Sepsis Core Measure diagnostic and treatment guidelines have been met within the time requirements. Dr. Lacoste notices that Melvin is already starting to look and feel much better. Melvin has responded to the treatment well and can now be transferred out of the ICU and to the medical floor. While rounding, Dr. Betthauser notices that Melvin's sepsis has resolved, and he will be discharged home soon. SSM Health data shows that patients who met SCP-1 Sepsis Core Measure criteria have a decrease in length of stay by 1 day. SSM Health data also shows that sepsis patients have a high rate of readmissions, so remember that sepsis patients need close follow-up care after discharge. Melvin was back to feeling great and on his way home to once again live happily ever after with his wife Barb. All of the doctors and nurses who took care of Melvin were ecstatic that his outcome was so great. Another life spared from sepsis because of timely identification and treatment. Remember that quick treatment of severe sepsis and septic shock following the Sepsis Core Measure guidelines results in positive patient outcomes. Be sure to reference your Sepsis Core Measure tip sheet often. For more information regarding sepsis identification and treatment core measure guidelines, please contact your ministry's Patient Safety and Quality Department. Thank you for joining us today, and a very special thanks to all of the SSM team members who helped make this amazing video possible. Remember, with sepsis, timing is everything.